You are watching your award-winning cable access station, Channel 13 and 19, Athol Orange Community Television.
Welcome to Quabbin Valley Health Links, a presentation of Quabbin Valley Healthcare in partnership with AOTV. This program is designed to link members of the community to health-related resources available in and around your local community. We serve to provide information on healthcare-related matters and other resources so you can make better, more informed healthcare decisions. Please visit us at qvhc.com for more information. Welcome to Quabbin Valley Health Links. I'm Michael Cacciadorian. On today's program, we have Tara Rivera from Fallon Navicare. And Tara is the Senior Care Products Account Executive with Navicare. So welcome to the program.
Thank you. I'm happy to be here.
Part of our mission with Quabbin Valley Health Links is to inform the community in and around Athol of healthcare services that are available to them in this community. Because we found that many people felt that they had to travel long distances to get services that they can get close to home. And not only does that pertain to hospital or skilled nursing care or things like that, but also insurance products that are offered in this community. And Fallon is one of those products that I think it's always been offered, but it seems like you're on a roll in terms of expansion out this way. And you have so many different products to offer. We're going to talk about Navicare today because it's very important, I think, for the senior community that we serve. However, I do want to touch upon all the Fallon products because they were all very valuable. So if you don't mind just giving us a brief history of Fallon, how long you've been around?
Sure.
And what types of products do you offer the community? And we'll talk about some of the differences of those as we go through the program.
Absolutely. So Fallon Health has been around since 1977. So it's been 37 years now. We've been serving the Northwestern County. And basically, for this area particularly, we actually offer a commercial plan, which is based for employers to be able to offer their employees. Mm-hmm. So those commercial plans entail Fallon Direct, Fallon Select, those types of things. We also offer plans for seniors to purchase directly through us, which would be like the Fallon Senior plans. Mm-hmm. And then we also have our Navicare plan and our Summit Elder Care plan for 65 and over folks.
Okay. And Fallon Total Care is another product for people.
Fallon Total Care is, yep, it's a dual eligible product for folks that are 22 to 64.
Okay. Let's take a step back for a moment and kind of dispel something that maybe I'm holding on to it and maybe other people know this. But the people I come in contact with still have a little bit of a misperception of where you cover. I know Fallon was sort of developed and born in the Worcester area, central Massachusetts. People associate it with St. Vincent's, but that's long ago. I think it's important that people understand that Fallon is a product that's available across Massachusetts with the exception of where?
With the exception of the islands and the Berkshire County.
Okay.
So Navicare and Fallon Health actually began in Worcester County, so I think that a lot of those misconceptions came about because we were raised there, born and raised in Worcester.
That's right.
So basically, we have since expanded, so we are actually all throughout Massachusetts now. And again, the only counties that we are not in are the islands as well as the Berkshire counties.
Okay. So you're very much entrenched in this market. People in this market in the Athol area don't have to worry about signing up for Fallon and thinking they only have to travel to Worcester. They're going to get the care they need here. You just actually became a provider, or is it a preferred provider for Athol Hospital and Haywood Hospital? Is that correct?
Yes, that is correct. We're very excited about that.
What does that mean? What does that entail?
So Haywood Hospital has signed a contract with the Navicare product.
Okay.
So we're actually going to be their preferred SCO, which is a Senior Care Options Plan. Mm-hmm. So we're their preferred provider. So if you are seeing a provider that's associated with Haywood Hospital or Athol Hospital, they rest assured that they are contracted with Navicare. So we are actually one of their preferred providers, which is we're very excited to have that connection.
Excellent. That's great. And physician groups and the whole 9 yards all contracted in this
Yes,
area. For
primary
Fallon
care
products.
physicians, specialists, facilities, everything.
So the good news is if you choose Navicare, for instance, or another Fallon product, chances are everything's going to stay the same in terms of your primary care and any services you may be receiving from specialists.
Absolutely.
That's great, because I think
Yes.
people in this community weren't sure or aren't sure what exactly is available to them if they are enrolled in Fallon. So that's great news. I think that's wonderful. Fallon Navicare is a product we work with at Quabbin Valley quite a bit. And I have seen the benefit of Navicare in so many different respects. And I wanted to talk about some of those things. Let's get a little bit to the nuts and bolts, though, of what is Navicare and who can qualify and sort of the eligibility aspects of this program.
Sure. Navicare is a program that was started in 2010, and it is for folks that are over 65 that have a Mass Health standard or are considered a frail elder. So there's two ways to qualify for Navicare. The first thing is you have to be over 65, so that's kind of a non-negotiable item. You can either be over 65 and have Mass Health standard, or you can be over 65 and be considered a frail elder waiver, and that would then qualify you for the program. So that would mean it's not income based, it's more clinically based on how you're doing in the community.
So can you expand on the frail elder piece for a moment?
Sure.
What does that mean?
Yep.
So you don't have Mass Health, but you have this opportunity to perhaps get it through a frail elder waiver, is that correct?
Yes, that's correct.
Describe that in more detail better than I can.
Yep. So basically, the frail elder waiver, to qualify for that, you have to be over 65, and your income has to be $2,199 per month or less. You have to have $2,000 or less in assets. Mm-hmm. And then you need to qualify clinically, meaning you have to have 2 daily needs of basically
Activities of daily
yes,
living needs.
ADLs,
Okay.
yeah. So you would have to need 2 of those, meaning you would either need help grocery shopping, cooking, cleaning, bathing. You may be a fall risk. You may need some help remembering to take your medication. You may need help transferring in and out of bed, or those types of things. So if any of those things would apply to somebody, I would tell them to, call us, and we have a little checklist that we could go through and see if this person may or may not qualify through the frail elder waiver.
I see. So if somebody is watching and they're saying, well, I can't qualify for Medicaid for whatever reason, they actually might. And that's where you can come in and provide assistance and guidance.
Absolutely.
'Cause maybe some people can.
Yes, I've been able to enroll a lot of folks through the frail elder waiver, and it's very rewarding to be able to help people that didn't think they actually could qualify for a program like this, and then they can, and we've been able to save them lots of money to do that. So it's been very rewarding.
Do people have to have Medicare?
You actually do not have to have Medicare to be eligible for Navicare.
Which that I think is remarkable, because we always think of you have to have Medicare to have what we in the industry call a replacement product, so to speak. But Navicare is different in that regard, and I think that's very important, because not everybody has Medicare for one reason or the other.
Right.
I mean, the majority of people do, but there are those that don't, and so they don't have to worry about that, which I think is great. So there's lots of benefits, I think, to Navicare.
Yep.
And really, and I don't want to misspeak, but my understanding is at no cost to, if they qualify, there's no cost, and there's a lot of added benefits that people get that they may not be receiving under traditional Medicare or Medicaid. Talk about that aspect of it, because I think that's very important. And
yes,
it's pretty remarkable what you provide.
Our what we provide is very, very rich program. So basically, Navicare is funded through the state and the federal government. So basically, all of your benefits that you would get through Mass Health, you would get those same benefits with Navicare. You would also get the benefits that you receive with Medicare. You would get those benefits as well. So even if you're coming on to Navicare at 65 and you only had Medicaid, you're getting your Medicare and your Medicaid benefits all in one.
Okay.
So that's kind of like the beginning pieces of it. So even if you didn't have those Medicare benefits prior to, you will now have those once you become a member of Navicare. In addition to that, there's a huge array of services that we offer. First of all, when you sign up with Navicare, you receive a navigator that gets assigned to you. We all know that the healthcare system is very confusing and complex. So this navigator kind of acts as your personal assistant to kind of walk you through and help you navigate the healthcare system. So you get a number, a local person to talk to and call any issues, any questions, any problems that you have. That person also helps you schedule doctor's appointments, schedule transportation, and help find specialists in the area if need be. So that person really becomes your point of contact after you sign up with Navicare, which is really helpful for the 65 and over population because they kind of tend to, get confused a little easier. Not that it's not confusing anyways, healthcare these days. But they have that navigator to kind of lean on and depend on for that kind of assistance, which is nice.
What are some of the other added benefits, do you think, that are different or that they otherwise may have a co-payment for?
Oh, there's several things. So when you go to visit your doctor, your PCP or your specialist, there's no co-payments for that. We cover 100% of all of your prescriptions, so your prescriptions are covered 100%. So folks that join Navicare prior to, if they have Mass Health, they may pay $1.50, $3.50 for their prescriptions. With Navicare, they're 100% free. We also cover vision. So we cover all of your vision care. We cover 100% of your dental care, which is a huge thing.
I think that's underestimated too, if I can just stop there for a second, because dental, I don't know the statistics, but I do know that oral health is very much an important aspect of your overall well-being. And there are certain things that I think if you don't take care of your oral health, could lead to cardiac issues and all these other different things, and people underestimate that. So if you have an insurance plan that doesn't cover dental, it can actually be a problem. So I think this is great because you don't usually hear about someone being covered in full for dental services.
I hear it time and time again when I go out and I speak to elders in the community. That's one big aspect that's missing from their care is that dental insurance. So if you think about it, if someone has dental issues or dentures maybe that aren't working for them anymore or are in need of dentures, that's affecting their health because they're not eating properly, or they may not be eating certain foods because of the fact that their mouth may hurt, or those types of things, which affects their nutrition, which then in turn affects their health. So the dental portion of our program is very important. We're pretty proud of the fact that we offer such an extensive package with this.
Sure. Anything else that's additional you can think of?
Absolutely. So we also cover transportation to and from medical appointments, and there's no PT1 forms needed for that. So that's kind of an added benefit we find with the Mass Health program. It generally takes up to 5 days to get transportation. With Navicare, it's within 24 to 48 hours you can get transportation. So that's really great.
Is the navigator helping with the transportation too?
Absolutely. The navigator facilitates the transportation. They can also schedule your doctor's appointments for you. So if I'm a Navicare member and I don't drive, and my navigator sets an appointment for me and knows I need transportation, her second follow-up phone call is automatically to set the transportation to and from that doctor's appointment for me.
So Navicare is very comprehensive. I mean, I think there's so many aspects of it that people don't necessarily know are available to them. So this is great. I think what would you recommend somebody do who is sort of at that moment in time where, do I stay on traditional Medicare if they're turning 65 and they have access to it, or if they're on straight Medicaid but don't have Medicare and they're over 65 and they're looking at different insurance plans? What do you recommend they do? I mean, can you guide people through this process and sort of help them, even if in the end they don't choose Navicare? But you're going to provide some guidance, or how does that work for the individual? Because it is overwhelming. It is.
I actually just had a phone call a few days ago with a woman who is 66, and she's just retiring. And she basically called to reach out for some suggestions and some help. So I basically kind of went through her and her husband's needs, their age, their medical conditions. We talked about their income, so I could kind of get a feel for what they may or may not qualify for. Their income was a little bit higher, so they did not qualify for Navicare. So I did refer them to our Fallon Senior Plan. In addition, I referred them to their local senior center. For help too, because the senior centers are very helpful in also guiding folks to get the information that they need to make those decisions.
So you're acting as a resource even if they don't choose to go on Navicare, which I think is very beneficial. I think people need that extra support, saying, what do I do? How do I look at all of these and make the best choice? So you can help in that respect. Now I'll talk about how people can reach you after at the end of the program. So if somebody, okay, so going back to the cost aspect, because it's very important in the senior community in particular. Someone's on Navicare, they go to the hospital. 100% covered?
100% covered, even the ambulance ride.
Even the ambulance ride. So no co-payments, any deductibles people have to worry about?
No deductibles, no co-insurance.
Okay.
They can go into the hospital, whether it's an ambulance ride or whether they've walked in through the emergency room or their doctor has referred them there. No co-payments, no co-insurance, no deductible. In addition to that, if, say for example, their hospital stay was due to a breaking of their hip and they need to go into a skilled nursing facility, we actually waive the 3-day hospital stay for them, which Mass Health requires.
That's right.
So if someone goes into the hospital with a broken hip on Mass Health, they have to stay in the hospital for 3 full days before they can qualify to go to a skilled nursing facility.
On Medicare.
On Medicare, yes.
Yes. But I think that's very important too, because people who are on Medicare, so we all know we're in this together. I always say to the guests on the show, our organizations are as similar as they are different, and we complement each other through this whole process, and we do what's right and best for the patients that we're caring for, because that's our goal. Your goal is to keep people in home as long as they possibly can be there through this program, and our goal is to help people get home as fast as possible so they can stay home. So that's sort of how that works. So if they do go to the hospital, part of what we do at Quabbin Valley, and I know part of what you do and other organizations do, is how to make the process less anxiety-ridden for people. And part of that is this qualifying stay under Medicare. So if you're just plain straight Medicare, you fell, or you went to the emergency room for whatever issue, but you don't meet hospital level of care. With Medicare, they're going to tell you have to go home because you can't come to a place like Quabbin Valley because Medicare requires 3 overnights for whatever reason. But the hospital doesn't want to admit the patient because they don't meet that level of care. With Navicare, that's gone. You're going to say to us, if they meet criteria to go to Quabbin Valley for short-term rehab or any other nursing home for short-term rehab, you dictate that and you say, okay, yes, if they want to go to you, they go, and then that care navigator you were talking about earlier follows them at the skilled nursing facility. Is that right?
That's correct.
So you actually stay involved. You're not just sort of walking away till that person comes back home. You're
Correct.
Involved.
We're involved in every transition of care. So a great example of that is my grandmother recently had a fall. She's on Navicare, and she went into the hospital. She did not have to stay there for 3 full days. She was released to a short-term rehab for, they sent her back home thinking she would be okay, but she wasn't feeling safe enough, and she was nervous she was going to fall again. So Navicare was able to get her into a short-term rehab so that she could work on getting stronger with her wheelchair and with her wrist injury, and then safely get her home. So
exactly. And
it was just a great transition. The whole team, the navigator, the nurse case manager, and the facility was just able to take her from home into the facility, from the facility back home. And for folks that are over 65, those transitions, like you said, they can be very anxiety provoking. So the more hands on deck and the less questions that people have, the better. So it ended up being a nice transition. It worked out really well, and I'm grateful that my grandmother's on Navicare.
Well, and I think too the fact that you just don't leave people to their own devices when they are admitted to a skilled facility for rehab. You do have that navigator that comes on site, that participates in our clinical meetings, participates in a care plan meeting, participates in discharge planning. Then you make sure the person has exactly what they need when they get home, help coordinate those services, and then the transition is just as smooth as it really can possibly be. And like I said before, part of our goal is to do what is in the best interest of that individual. And if that means going home, that means going home. And we all work and participate in that together, which I think is fantastic. I think people don't understand that we really do work hand in hand to help people accomplish their goals and get as independent as possible.
Absolutely.
So people look at the enrollment process as a nightmare. You know, they say, "Oh boy, it's time to enroll," or "I want to enroll," or "What do I do?" and how do I do it? It's a lot of paperwork. How do you help them? Because I think you make this pretty easy for people.
I do. I actually do all the paperwork myself, and I just need 4 signatures when it comes time to sign. So basically, when I meet with folks and we talk about Navicare, we see if they qualify. If they qualify and they want to actually do an application, I go to their home. And when I go to their home, I actually ask them to invite their family if they would like. I'd like everybody to be on the same page so everybody understands what Navicare is and all the benefits that it has to be able to include the family and help the family and alleviate some of the things that they may be doing for the member. So I go to their home, we sit down, we fill out the application. Like I said, I do all the paperwork, and then it's just 4 simple signatures. The nice thing about Navicare is there's no open enrollment period.
I was going to say, is there a period where you can't enroll? You can do this on an ongoing basis.
Absolutely, all year long, which is great. So you can enroll anytime. You can also disenroll anytime.
Okay.
I haven't had anybody disenroll on me yet, but you can do that. So say, for example, you were 65 and we were going to do an application. I'd come to your home and we would sit down and we would do the application, and then it being May, June 1st, you would be effective with Navicare. So all of your current insurance would stay in place until the 1st of the following month, and then you would be effective with Navicare. So June 1st, you would be effective with Navicare.
I see. Well, that's amazing. That makes it very easy.
Very quick, very simple. Yeah.
So what is the difference, I guess? I'm just trying to think of the right way to phrase this. Fallon Senior Health, right? It's different than Navicare. It's
Yes.
different than Fallon Total Health. So I think let's talk about Fallon Senior for a second versus Navicare, because they're both products where you have to be over 65. Is that correct? But what is the main difference in, you know, why Navi over that, for example? Navi short for Navicare.
Navicare, yep. So basically, Navicare, you have to be over 65, and it's more income based.
Okay.
So if you have Mass Health, you're following under the Mass Health guidelines, or if you're under the Frail Elder Waiver, you're following under the Frail Elder Waiver guidelines. So the Fallon Senior Plan is for folks that don't qualify for the Navicare product.
Okay.
And basically, it's an all-encompassing program, just like Navicare. Our employers, local employers in the area, do offer that plan to their older employees as well. And I have taken a lot of Fallon Senior folks who their health has deteriorated and been able to transition them into the Navicare product.
Okay, that makes sense.
So they can actually not age into it, but age and as well as clinically kind of move into that product. So
and also people's income changes. So it's 65 to 70, they may be in one income situation, but over 70 or at some point in time that changes.
Absolutely.
Which then might qualify somebody for the Navicare, Navicare product versus Fallon Senior Health.
And we do referrals to each other all the time. So the Fallon Senior Plan may have somebody that has approached them about, you know, getting health insurance, and they say, oh, you know, after meeting with them and kind of figuring out A to Z, you know, what their needs are, what their income is, et cetera, they say, you know what, you'd qualify for the Navicare program. Let's get you, you know, in touch with someone that can help you for that. And then for me, same thing. If I talk to somebody and I say, well, your income is a little high, but we do have a Fallon Senior Plan that may work for you, then I get them in touch with the representative for the Fallon Senior Plan. So it kind of works both ways.
I see. And then at the beginning of the program, you mentioned a little bit about Summit Elder Care. Am I correct with that?
Yes. Yeah.
Briefly, what is that compared
Summit
to?
Elder Care is it's a PACE program. So it's a all-inclusive program that basically covers A to Z. So Summit Elder Care is the insurance company and the provider. So it's a very unique program.
Okay.
The closest site to us here would be our Leominster location. We have 4 locations currently, and we're expanding as well. So that program is doing well also. It's a 55 and over, and there's no income guidelines for that.
I see.
So it's a little bit different.
Okay. But there may be the need in that respect only to change physicians or providers, perhaps.
That's correct, yes, because Summit Elder Care is actually an insurance company and the provider.
Okay.
So you would actually see the doctor at the Summit Elder Care site.
Okay.
You would also see your specialist at the Summit Elder Care site. The Summit Elder Care site also acts as an adult day health program. So it's really nice because they closely monitor your loved ones, and so if you're not able to do that or they're really not able to stay home and it's not safe, they can actually go to this adult day health program during the day. There's a doctor on site, there's medical staff on site, so if they're deteriorating or if there's any issues, it's caught relatively quickly. So it's a great program as well.
So getting back to Navicare, successes with it. I know there's probably a million stories you have, but can you think of one or two that I think exemplify exactly what Navicare does?
Absolutely. I love Navicare. I love helping people. I don't feel like I'm working every day because I really feel like I'm making an impact in people's lives. So I was doing a presentation in Winchendon, and I met a man who came up to me and said, I've had Navicare since 2011 and I love it. He told me that he had come down with cancer, and he went through chemo, he went through radiation, and he's fine today, and not one penny came out of his pocket when he was on Navicare. So he couldn't rave about it enough, and he was so grateful, and he loved Navicare, and he wanted to let me know that. So that's one story that I like to share with people because I just think it's amazing when you have that diagnosis of cancer. I mean, there's so many things going through your thought and your mind, and the last thing you want to think about is that hospital bill or those bills for the drugs that you need to take or those types of things. So how wonderful was it that he went through chemo, went through radiation, he's recovered, and not one bill did he have to pay.
Wow.
So that was pretty amazing. I really like that story.
Wow, that's incredible. And you did, of course, you talked about your grandmother's success too.
Yeah, my grandmother's been on Navicare for a little over a year now, and they've been able to assist her in getting into assisted living facility. She needed help with a walker, so they assisted her in getting a walker, all of our medications delivered, and those types of things. They were just unbelievable at just kind of being there, being present, seeing a need, and fulfilling that need.
Nice. Now, how do you fit into a VNA service? You're just, as long as they can use any VNA they want, as long as the VNA is contracted with Fallon, and in particular the Navicare product?
That's correct.
Okay, so someone could choose to have whatever VNA service they would like, visiting a nurse agency that they would like to receive services at home, and you're going to cover that as well if they're a Fallon Navicare contracted provider. Is that correct?
Yes, that's correct.
Okay.
So anybody that's at home, if they need physical therapy, occupational therapy, speech therapy, those types of things, post-hospitalization, some people need a nurse to go in to do, shots or, those types of things. So we cover all of that as long as it's medically necessary, and our, care team has said, yes, this is something that this member needs. We've been able to go ahead and provide that.
Excellent. And you're involved in the community quite a bit. We just have a couple minutes, but I just wanted to touch upon that because it's important that people understand you sort of give back. You're always doing something for the members of the community, which I think is very important. Quabbin Valley does the same thing. We're committed to the communities we're in. What are some of those things that you do? I know you're also in and around this area all the time doing in-services or educational programs, but you sponsor certain things, and just briefly talk about that.
Yep. That's one of the things that I feel prideful about when I tell people I work with Fallon Health and I work with the Navicare program. Fallon Health has always been serving their communities. They've been around for 37 years and they've served their community for 37 years. Some of the things that we've sponsored in the area are some local Little League teams. We've also, we're partnering right now with the Greater Gardner Suicide Prevention Task Force, which is huge, and we're really happy and proud to say that we're doing that. The North County Quad Series 5Ks we've sponsored. And then we're really big into hunger relief as well. So we've raised over $100,000 in the last 8 years doing golf tournaments and then giving it to the local hunger relief. So we work with the Athol Council on Aging, the Salvation Army, and the Meals on Wheels in Orange, just to name a few.
Absolutely. And we work a lot together, Quabbin Valley and Navicare, and give back in different ways that we can to members of our community. We co-sponsored we aligned with each other for the Great Pie Giveaway, as I call it, last Thanksgiving time, we'll probably do something similar to that. But again, it was just a way that we could provide some type of relief for people in the community during the holiday season when it's tight for people financially to have access to certain things. So,
Absolutely. It was very rewarding, and people were so grateful.
Absolutely.
And it was so nice to be part of that.
Yeah, it was great. So, well, this has been a great conversation. There's a lot of information here for people to take in. So, in addition to watching the program, I think it's good to point people to your website, which is fchp.com, if I'm correct?
.org.
.org, yes. So Fallon, short for Fallon Community Health Plan, but fchp.org. Or you can call Tara directly if you want a consultation or more information. And hopefully I have your phone number right. And that's 774-312-3179. So again, fchp.org. And Tara's direct line is 774-312-3179. And as always, thank you for watching. And please visit Quabbin Valley website for more information as well at qvhc.com. Thank you for watching.